Good evening, students, and thank you for tuning in to Ask Dr. Acula with me, Dr. Acula. Tonight's episode is on a topic that is close to my heart, if I had one. Blood drugs. The first question comes from Jill from Ohio. What is the characteristic appearance of red blood cells in a patient with iron deficiency anemia from chronic blood loss? It's a great one, Jill. The answer is hypochromic and microcytic. Now, our next question came off our new message board from user First Year Sucks. What are the clinical uses of erythropoietin? Another good one. The answer is anemia caused by end-stage renal disease, anemia caused by HIV infection, and anemia in some cancer patients. It doesn't work, however, on anemia caused by the undead who feed upon the living. Thank you again for joining me. And remember, your exams don't have to suck. Unless, of course, you're me. Good evening, students, and welcome back to Ask Dr. Acula. I, of course, am Dr. Acula. Tonight's question comes to us from Carrie, a student from New York. Dear Dr. Acula, love the show. What treatment is recommended for xeroderma pigmentosum? Great question, Carrie. As you know, xeroderma pigmentosum is an autosomal recessive genetic disorder of DNA repair, in which there is an inability to repair thymidine dimers caused by damage from UV rays. If left unchecked, this damage can cause mutations in the individual cell's DNA, which can affect proto-oncogenes, resulting in skin cancer. In extreme cases, treatment is avoiding all exposure to sunlight, which is why patients with this disorder are sometimes referred to as children of the night. Great question, Carrie. And remember, studying doesn't have to suck. Good evening once again, students. So happy you could join me for another episode of Ask Dr. Acula. Tonight's topic literally has me salivating. Let's talk about blood. Tonight's question comes from Andrew in Boston. Dear Dr. Acula, my classmates and I never miss your show. You rock. Could you better explain the ABO blood types and universal recipients and donors? Oh, on this topic, I consider myself an expert. People with type AB blood express both A and B antigens on their red blood cell surface, but absolutely no A or B antibodies are found in their blood. This means that they can receive any type of blood, which makes them universal recipients. However, only people with AB can receive AB. Now, people with type O blood, on the other hand, express absolutely no A or B antigens on their red blood cell surface, but both A and B antibodies are found in their blood. Therefore, type O blood types are universal donors. Also, only type O people can receive type O. Now, the great thing about being a vampire is everyone's a universal donor. Good evening. Dr. Acula here once again for tonight's Ask Dr. Acula. Tonight's question comes to us from Paul in Los Angeles. Paul writes, Hey there, Dr. Acula. Your show is great and I dig your cape. Why, thank you, Paul. What condition is caused by lesions of the long thoracic nerve? The long thoracic nerve innervates the serratus anterior, which is located on the side of the thorax and acts to pull the scapula forward. Trauma to this nerve, in turn, causes the shoulder blade to protrude from a person's back. This condition is known as winged scapula. Great question, Paul, and you guys keep those questions coming. Now, I've got to fly. Good evening, students, and thanks again for tuning in to another episode of Ask Dr. Acula. Tonight's question comes to us from Cindy, a second year at Washington. What's up, Dr. Acula? I'm your biggest fan. Oh, having some trouble with microbiology. Could you help me out? What are the opportunistic fungal infections? Thanks, Cindy. It's always great to hear from a fan. Now, microbiology is a tough subject, so let's clear it up for you. The opportunistic fungal infections, or those which typically affect patients with a compromised immune system, are Candida albicans, Aspergillus, Cryptococcus neoformans, Mucor and Rhizopus species. Thanks again, Cindy. Now, as a special treat, why did the Aspergillus fumigatus go to the party? He's a fun guy. I love that one. Get it? It's a fun guy? No? Good evening. Welcome to another episode of Ask Dr. Acula. Tonight's question comes from Gary, a student out of Tulsa, Oklahoma. Gary writes, Dear Dr. Acula, first of all, bite me. What serologic marker for hepatitis B indicates contagiousness? Oh, great one, Gary. As you know, hepatitis B infection can cause liver disease with vomiting and jaundice, and sometimes chronic liver disease. It can also cause kidney disease and increase the risk of hepatocellular carcinoma. To remember the serologic marker that indicated contagiousness for hepatitis B, just remember, beware for the hepatitis B envelope antigen. As always, thanks for writing, and remember, studying doesn't suck, but I do.